Did you know there is one simple, accessible exercise that has the power to drop your blood sugar by up to 30%, sometimes in as little as an hour after doing it? And the best part? You can do it even if you have severe joint pain, balance issues, or use a walker or a wheelchair. This isn't a gimmick or some far-fetched promise. This is a medical fact grounded in decades of research and confirmed by the experiences of thousands of my own patients. I'm Dr. Robert Clark, and for over 30 years, I've dedicated my practice to helping seniors not just manage their health conditions, but truly thrive. Today, we're tackling one of the biggest health challenges facing our community: Type 2 diabetes. A staggering statistic from the CDC reveals that over a quarter of Americans aged 65 and older are living with diabetes. And for many, a new diagnosis feels like a life sentence of complicated diets, confusing medications, and exercise routines that feel completely out of reach. I see it every day. Well-meaning doctors or trainers tell my patients to just exercise more. They recommend high-intensity programs or gym memberships that are simply not practical for someone with arthritic knees or fear of falling. This advice, while well-intentioned, often fails because it doesn't meet you where you are. It can lead to frustration, feelings of failure, and even injury. It creates a cycle where people feel so overwhelmed by the perfect exercise plan that they end up doing nothing at all. Let me tell you about my patient, Arthur. When Arthur was diagnosed with type 2 diabetes at 72, he was handed a stack of brochures with pictures of people half his age running marathons. He felt defeated before he even started. "Dr. Clark," he told me, his shoulders slumped, "my knees ache just walking to the mailbox. How am I supposed to do any of this?" Arthur's story is not unique. It's a common and valid fear that the tools for good health are no longer accessible. But I am here today to tell you that is absolutely not true. We are going to throw out that all-or-nothing mentality for good. The most powerful tool in your fight against high blood sugar is not in a gym, and it doesn't require expensive equipment. It's a simple, rhythmic movement you learn to do as a child. I'm talking about walking. And before you say, "But, Dr. Clark, I can't walk very far," I want you to hear me clearly. We will cover powerful modifications for every single level of mobility, from walker-assisted techniques to highly effective exercises you can do from the comfort and safety of your favorite chair. In this video, I will not only show you how to do this exercise safely, but I'll explain the incredible science behind why it works so effectively. We're going to build a simple 4-week action plan to get you started, and I'll share the stories of patients just like you who have used this one exercise to fundamentally change their health. You have more power over your blood sugar than you've been led to believe, and it starts with the very next step you take. So, what is the magic behind this seemingly simple activity? How can walking, something many of us do without a second thought, have such a profound and immediate impact on blood sugar levels? The answer lies within our largest organs: our muscles. Understanding this process is the first step to truly taking control, because when you understand the why, the how becomes so much more meaningful. Think of your muscles, especially the large muscles in your legs and buttocks, as giant, hungry sponges for sugar. The how becomes so much more meaningful. Think of your muscles, especially the large muscles in your legs and buttocks, as giant, hungry sponges for sugar. The how becomes so much more meaningful. Think of your muscles, especially the large muscles in your legs and buttocks, as giant, hungry sponges for sugar. After you eat a meal, the carbohydrates you consume are broken down into glucose, a type of sugar that enters your bloodstream to be used as fuel. In a person with type 2 diabetes, the body's ability to move this glucose out of the bloodstream and into the cells is impaired, which is why blood sugar levels rise and stay high. This is where walking comes in. It's like sending out a system-wide announcement to all of those muscle sponges. When you start to walk, your muscles contract. This simple act of contraction triggers a powerful, non-insulin-dependent mechanism in your body. Now, you might ask, why walking? What makes it better than other, more intense forms of exercise? It's a fantastic question. While vigorous exercise can be beneficial, for many seniors managing diabetes, it can sometimes be counterproductive for immediate blood sugar control. Very intense exercise can cause the body to release stress hormones like adrenaline and cortisol, which can actually signal the liver to release more glucose into the bloodstream, causing a temporary spike. Walking, on the other hand, is a gentle, steady-state activity. It activates the muscles enough to open those GLUT4 doors without triggering that stress hormone response. It's the perfect balance. It's low impact, which protects your joints. It's free. And it has been proven time and time again in major clinical studies to be one of the most effective ways to reduce post-meal glucose spikes and improve long-term glycemic control, as measured by your A1C. The science is clear. A simple walk, timed correctly, is not just exercise, it's a potent dose of medicine you can administer yourself. Now that we understand the incredible science at work, let's translate that knowledge into action. We'll start with the foundation. The proper way to walk for those who are mobile, even if you're just beginning your fitness journey. Because how you walk can make all the difference in terms of safety, effectiveness, and enjoyment. Many of us develop habits over the years, slouching, looking down at our feet, taking short, shuffling steps that can lead to poor balance and discomfort. We're going to correct that right now. The first and most important element is your posture. I want you to imagine there's a string attached to the very top of your head, gently pulling you upward toward the ceiling. Feel your spine lengthen. Now, let your shoulders relax. Roll them back and down, away from your ears. Your chin should be parallel to the ground, and your eyes should be looking forward, about 10 to 20 feet ahead of you. This isn't about being rigid, it's about being tall and aligned. This posture does more than just help with balance, it opens up your chest, allowing you to breathe more deeply and deliver more oxygen to those muscles that are working so hard for you. Next, let's talk about your movement. Your arms should swing gently from your shoulders, not your elbows, in a natural rhythm opposite to your legs. This provides momentum and helps you maintain balance. As for your feet, focus on a smooth, rolling motion. Your heel should strike the ground first, then your foot should roll through to your toes, which then push off for the next step. If you've been inactive for a while, the idea of a long walk can feel intimidating. So, we're not going to start there. If you're new to this, your goal for the first week is simply 5 to 10 minutes a day. That's it. You can do it in your home, down the hallway, or outside to the mailbox. The goal right now is consistency, not intensity. I often tell my patients to use the talk test. While you're walking, you should be able to carry on a conversation comfortably. If you're so breathless you can't speak in full sentences, you're pushing too hard. If you could easily sing a song, you might have room to pick up the pace a little. This simple test ensures you're working in that perfect, moderate zone that's ideal for burning blood sugar. Finally, let's talk about the most important piece of equipment you will ever own for this activity: your shoes. For anyone, but especially for someone with diabetes, footwear is not the place to cut corners. Nerve damage or neuropathy can reduce sensation in the feet, meaning you might not notice a small blister or sore until it becomes a serious problem. You need a pair of supportive, well-fitting shoes. Look for a few key things: a wide toe box that gives your toes plenty of room to move, good arch support to prevent strain, and a cushioned, flexible sole that absorbs impact. Always check your feet for any red spots, sores, or blisters after you walk. Think of your shoes as an essential prescription for your health. I had a patient, David, who insisted on walking in his old, worn-out slippers. He developed a nasty blister that got infected and took weeks to heal, setting him back from his goals. After that, he invested in a good pair of walking shoes and never looked back. He said, "I realized I was protecting my independence." And that's exactly what you're doing. You are building a foundation for a healthier, more independent future. one safe and supported step at a time. Building on that physical foundation of good posture and proper footwear, we need to address two other critical components: a safe routine and a strong mindset. These are the elements that transform a walk from something you have to do into something you get to do for your health. First, let's be strategic about safety, beginning with your blood sugar numbers. If you use a glucose meter, it is your most powerful tool for feedback and motivation. I advise my patients, especially when they are starting out or if they are on medications like insulin, to check their blood sugar before and after their walk. This gives you vital information. If your blood sugar is a bit low before you start, say below 100 mg/dL, it's wise to have a small, healthy snack containing about 15 grams of carbohydrates, half a banana or a few whole grain crackers, for example. This prevents your blood sugar from dipping too low during your walk, a condition called hypoglycemia. After your walk, check your numbers again. Seeing that number decrease is concrete proof that your effort is working. It's not just a feeling, it's data. It's the motivation that will keep you going on days you don't feel like it. It's also important to be prepared. Always carry a source of fast-acting sugar with you, like glucose tablets or a small juice box, just in case you do feel the symptoms of low blood sugar, which can include shakiness, sweating, or dizziness. Think of this as your safety net. It allows you to walk with confidence, knowing you are prepared. Let me tell you about Eleanor, a wonderful patient of mine who was 78 when she was diagnosed. Her biggest fear was hypoglycemia. She was so scared of her sugar dropping that she was afraid to move. We created a plan. She started by just walking back and forth in her living room for 5 minutes after lunch. She checked her sugar before and after every single time. After a week of seeing the numbers go down consistently but safely, she felt confident enough to walk to her mailbox. The next week, it was to the end of her block. Eleanor Idas Victory was in T, running a 5K. It was the day she realized she held the data in her hands and was no longer afraid. That is true power. The second piece is your environment and mindset. Choose a safe place to walk. This means a path with an even, well-paved surface to minimize the risk of tripping. If you're walking outside, choose a well-lit area and be aware of your surroundings. Many of my patients enjoy walking at a local mall, especially in bad weather, because the environment is climate-controlled and the ground is perfectly flat. The key is to remove as many barriers as possible. But the biggest barrier is often not the weather or the terrain. It's the one between our ears. The mental game is half the battle. If you think of this as a grueling workout, it will feel like a chore. I encourage you to reframe it. This is your movement medicine. This is your dedicated time to care for your body. Put on your favorite music, listen to a podcast, or call a friend and walk with them. Associate this activity with pleasure, not pressure. Ask yourself, what would make this walk feel like a treat? Maybe it's the quiet time to yourself or the chance to see what is new in the neighborhood. By shifting your mindset, you build a sustainable habit rooted in self-care, which is the most powerful kind of motivation there is. Now we arrive at a critically important part of our discussion. What if traditional walking is simply not an option for you? What if you live with chronic joint pain, severe balance issues, or rely on a walker to get around? This is where so many people believe their journey ends, but I'm here to tell you this is just a different beginning. The principle of movement medicine is universal. Remember our goal, to get the large muscles of the body to contract and soak up that excess blood sugar. You absolutely do not have to be standing and walking unassisted to achieve this. We just need to modify the approach. For many, a simple kitchen chair can become the most effective piece of exercise equipment you own. Let's start with chair-based walking. I want you to try this with me right now if you are able. Sit on the edge of a sturdy chair, one without wheels. Place your feet flat on the floor, about hip-width apart. Sit up tall, engaging your core muscles, just like we discussed with our walking posture. Now, simply begin to march in place. Lift your right knee, then your left knee, in a steady, comfortable rhythm. As you do this, let your arms swing naturally, just as they would if you were walking. Right arm forward with the left knee, left arm forward with the right knee. You are now chair walking. You are engaging your quadriceps, your hamstrings, and your glutes. All of those large, sugar-hungry muscle groups. The beauty of this is that your body is fully supported. There is zero impact on your knees or hips and virtually no risk of falling. You are in complete control. Can you do this for just 5 minutes while watching your favorite television show? Absolutely. That 5 minutes counts. It tells your GLUT4 transporters to get to work. From this basic march, you can add variations. Try extending your leg and tapping your heel on the floor, then your toe. Alternate legs. This works the muscles in a slightly different way. You can add more exaggerated arm swings to engage your upper body. The key is continuous, rhythmic movement. Now, for those who are able to stand but use a walker for support, the principles of safe walking are even more crucial. Your walker is your stability partner. It should not be something you hunch over and push far out in front of you. Stand tall inside the frame of your walker. When you move, you should push the walker forward just a short distance, then step to it. Your steps will naturally be smaller, and that is perfectly fine. The goal is safety and stability, not speed. A patient of mine, George, had a bad fall and became very reliant on his walker, taking only shuffling steps. We worked on his form. Walker, step, step. Walker, step, step. This deliberate pattern retrained his brain and his body. It rebuilt his confidence. He focused on a smooth, heel-to-toe roll, even with his shorter steps. He started by walking a single lap around his kitchen island. Today, he walks the entire perimeter of his community garden, checking on his tomatoes. His walker didn't limit him, it enabled him to reclaim a part of his life he loved. That is what this is all about. Continuing with our modifications, we must address another group of individuals for whom movement is not only possible, but profoundly beneficial: those who use a wheelchair. It is a dangerous myth that if you are unable to use your legs, you cannot get the blood sugar-lowering benefits of exercise. This could not be further from the truth. Remember the core principle: muscle contraction. Your upper body, your arms, shoulders, back, and chest, is filled with muscles that function exactly like the ones in your legs. When they work, they need fuel, and that fuel is the glucose in your blood. You simply have to ask them to do the work. The chair you are in is not a barrier, it is your stable foundation from which you can launch a powerful offensive against high blood sugar. Let's explore some highly effective seated exercises. The simplest form is arm walking or air punching. Sit tall in your chair, engaging your core to support your spine. Extend your arms in front of you as if you are holding bicycle handlebars. Now, begin a rhythmic punching motion, alternating arms. 1, 2, 1, 2. Find a pace that feels comfortable. You can imagine you're a boxer, focusing on controlled, deliberate movements. Feel the muscles in your shoulders, your back, and your arms engaging. This movement elevates your heart rate and demands energy from your muscles, triggering that same GLUT4 response we've been talking about. You are, in effect, walking with your arms. Can you do this for the duration of a single song on the radio? 3 or 4 minutes? That is a fantastic start and a meaningful dose of your movement medicine. To increase the intensity and effectiveness of these seated exercises, we can introduce a simple, inexpensive tool: resistance bands. These large, stretchy bands can be a complete game changer. By adding resistance, you force your muscles to work harder with every repetition. A harder working muscle is a hungrier muscle, meaning it will soak up even more glucose from your bloodstream. It's like upgrading your muscle sponges from regular to industrial strength. For example, you can loop a band under the legs of your chair and perform bicep curls. You can wrap it around your back and do a chest press, pushing your hands forward. You can even place a band around your thighs and push your knees outward to work your hip muscles. The possibilities are endless. I had a patient named Brenda, a wheelchair user for over a decade, who felt completely disconnected from the idea of exercise. I introduced her to resistance bands. She started with a light resistance band, doing just a few minutes of arm exercises each day. Within a month, she reported feeling stronger, having more energy, and, most importantly, her post-meal blood sugar readings were noticeably lower and more stable. She told me, "For the first time in years, I feel like I have a weapon to fight back with." That feeling of empowerment is just as important as the physiological benefits. The question is never, "Can I exercise?" The question is, "How can I exercise?" And, as you can see, there is always an answer. While the direct impact on blood sugar is our primary focus today, it would be a disservice not to highlight the extraordinary bonus benefits that come with this simple habit of walking. When you commit to regular movement, you are not just treating one condition, you are initiating a cascade of positive changes that ripple throughout your entire body and mind. One of the most significant of these is a dramatic improvement in your cardiovascular health. Think of your heart as the central engine of your body and your blood vessels as the intricate highway system. Diabetes, especially when blood sugar is uncontrolled, can make these highways stiff and narrow, leading to high blood pressure and an increased risk of heart attack and stroke. Walking is the ultimate road maintenance crew for this system. Regular, moderate-paced walking strengthens your heart muscle, allowing it to pump blood more efficiently with less effort. This directly helps to lower your blood pressure. Furthermore, the act of walking improves the elasticity of your blood vessels, making them more pliable and less prone to damage. The research on this is overwhelmingly positive. Studies have shown that regular walking can cut the risk of a heart attack by up to 30% in people with diabetes. So, with every step you take to lower your blood sugar, you are also taking a powerful step toward protecting your heart. But the benefits don't stop there. Walking improves circulation to every part of your body, including your joints and your brain. It enhances your sense of balance and coordination, which directly reduces your risk of falls. And we cannot forget the profound impact on your mental and emotional well-being. Physical activity triggers the release of endorphins, which are often called the body's feel-good chemicals. They act as natural mood elevators and pain relievers. A brisk walk can do more to clear your head and lift your spirits than almost any pill. This leads to better sleep, reduced stress, and an overall greater sense of control and independence. So, how do we put all this into practice? We start with a simple, manageable plan. This isn't about shocking your system, it's about building a sustainable habit. Here is your 4-week action plan. For weeks 1 and 2, your only goal is consistency. Aim for just 5 to 10 minutes of walking or modified movement each day. The focus is not on speed or distance, but on creating the routine. Just get it done. In weeks 3 and 4, we'll build on that foundation. Try to increase your time to 15 to 20 minutes a day. You can break this up if you need to. 2 short 10-minute sessions are just as effective as one 20-minute session. Your goal is to accumulate time and steps. At this point, you might aim for a weekly step count of around 4,500 steps if you use a tracker. From there, your ongoing goal is to work toward the 150 minutes of moderate intensity activity per week recommended by the American Diabetes Association and the American Heart Association. That number might sound daunting now, but by following this gradual plan, you'll find it's incredibly achievable. Write down your walk times and your blood sugar numbers in a log. Watching those numbers change over the weeks is the best motivation you could ask for. As we come to the close of our time together, I want to leave you with a few final words on safety and, most importantly, on hope. While this simple exercise is incredibly safe for most people, it is essential to listen to your body and work with your healthcare provider. Before starting any new exercise program, no matter how gentle, it's always wise to have a conversation with your doctor. They know your personal health history and can offer guidance tailored specifically to you. And while you are walking, your body will give you signals. It's your job to listen. If you ever feel dizzy, lightheaded, experience chest pain or pressure, or become unusually short of breath, you must stop immediately. These are not signs of weakness. They are important signals from your body that it needs a rest. Don't push through pain. Gentle muscle soreness is normal when you're starting, but sharp or persistent pain is not. The goal is to build your health, not to harm it. I want to share one last story with you, the story of my patient, Margaret. When I met Margaret, she was 68, newly diagnosed with diabetes, and her A1C was dangerously high. She felt utterly hopeless. She told me, with tears in her eyes, "I feel like my body has betrayed me." We started with a very small goal. Walk for 5 minutes in her backyard after dinner every night. Some nights she said she didn't want to, but she did it anyway. Slowly, 5 minutes became 10, then 15. She started walking around her block. She met neighbors she'd never spoken to before. A year after that first 5-minute walk, Margaret came into my office with a huge smile. Her A1C had dropped into the pre-diabetic range. Her doctor had been able to reduce her medication. She had lost 15 pounds. But she said the best part was, "I got my life back, Dr. Clark. I didn't find some magic pill. I found a sidewalk, and I just decided, step by step, to walk back to health." Margaret's story, and the stories of thousands like her, is the proof. Your diagnosis is not your destiny. Your current mobility level is not your limit. The power to fundamentally change the course of your health is within you, and it begins with a single, deliberate choice to move. Whether that movement is a walk around the park, a march in your living room chair, or rhythmic movements with resistance bands, it all counts. It is all medicine. You are not alone on this journey. I want to build a community of support right here. In the comments below, I want you to share your story. What is one small step you can commit to taking this week? Let's encourage one another. Your story might just be the one that inspires someone else to take that first critical step. If you found this information helpful and want more evidence-based guidance for senior health, please hit that subscribe button and ring the notification bell. It truly helps us reach and empower more people just like you. Thank you for your time. Be well and know that you have the power to take that next step.